Good morning. My topic is dialyzer reprocessing. Myself Santoshi, tutor, Faculty of Allied Health Science. Reuse. Reuse is nothing but the dialyzer which is used many times by cleaning, disinfecting and used again for the same patient instead of thrown away is known as the dialyzer reprocessing. For benefits of medical or non-medical reasons, the dialyzers are reprocessed as per the AMI standards, and dialyzer facility may use dialyzer for some patients for multiple treatments. Types of reuse. There are two types of reprocessing technique. First is automated and the second one is manual. General aspects for reprocessing of dialyzers. So when patients who are infected with hepatitis B and hepatitis C and HIV, you should take all these things in considerations. So when you're reprocessing the hepatitis C infected person's dialyzer, you should have a separate reprocessing area, and you should have a separate reprocessing area for the negative patients. And for HIV, the reprocessing of dialysis is safe, but in hepatitis B, the dialyzer should not be reprocessed because of the risk of transmission is high. Reuse procedure involves a high risk of mucosal splash with contaminated material. The risk of transmission of hepatitis B is 30%, which is high, so it should not be reprocessed. Hepatitis C is 3% and HIV is 0.3%, which is safe, and it should be reprocessed in a separate reprocessing area. Phases of reprocessing technique. Reprocessing technique is classified into three phases: pre-first use, dialysis treatment, post-dialysis. Pre-first use. When you assign a patient a dialyzer, it should be labeled with their name and date in the dialyzer. So prior to initial use, the dialyzer should be pre-processed to measure the baseline total cell volume, and then the dialyzer should be rinsed and pressure tested. The dialysis treatment. Before you use a reused dialyzer, you should check whether the dialyzer is discolored, leaking or clotting of fibers in the header. So you should check the presence of germicide by a strip test with appropriate sensitivity, and then you should prime the dialyzer with normal saline for 15 to 30 minutes, and after that you should check that the extracorporeal circuit is free of residual germicide. Post-dialysis. At the end of the dialysis, the staff should return the blood in the dialyzer to the patient. The patient care provider or the staff member transport the dialyzer to the reprocessing area, making sure that the dialyzer are capped and no cross-contamination with other dialyzers. And then the dialyzer is rinsed, cleaned, tested, disinfected, inspected, labeled and stored until the next use. Automated reprocessing. The automated reprocessing machine should be capable of performing three tests, namely estimation of fiber bundle volume, UF coefficient and pressure leak testing. These all should be recorded and carrying out the disinfection cycle of its hydraulics. The chemicals required for cleaning and disinfection cycles should be connected to the machine as specified by the manufacturer. Periodic changing of the chemicals should be carried out with checks for exhaustion, and if it is exhausted, you should change. This is automated reprocessing machine. Manual method. Steps for reuse: rinsing, cleaning, test for dialysis performance, disinfection or sterilization, final inspection, labeling and storage. Rinsing and reverse ultrafiltration. To minimize the clotting and maintain the patency of fibers, the blood should be returned with heparinized saline. Once the blood compartment has been exposed other than a sterile fluid, it should be reprocessed quickly. Cleaning. Rinsing the dialyzer and cleaning the headers with RO water. Water which is used for rinsing, it should meet the minimum standard which is set by the AAMI. So the prolonged rinse with RO water followed by the reverse ultrafiltration shows effective means of cleaning the dialyzer without the addition of the chemicals. Chemicals used in dialyzer reprocessing, one which is sodium hypochlorite bleach. So the sodium hypochlorite is diluted to 0.6% or less. That dissolves the proteinaceous deposit that might occlude the fiber. Hydrogen peroxide. It is used as a cleaning agent. It should be installed only in the dialysis compartment, not the blood compartment, because it might damage the membrane. It does not remove any protein deposits. It should be stored in an airtight container. Formaldehyde or formalin. It is one of the cleaning and disinfecting agent used in the reprocessing of dialyzer. It is a chemical disinfectant used to control bacterial contamination. Glutaraldehyde. Glutaraldehyde is a sterilant and used to disinfect dialyzer machine and preserve the end caps, universal connectors, O-rings and dialyzer caps. So it should be freshly prepared and activated. The solution should be replaced at the intervals of not less than 10 days. Peracetic acid or Renalin is a mixture of acetic acid and hydrogen peroxide. It kills bacteria, fungi and virus. Minimum dwell time will be 11 hours, can be used as a cleaning agent or sterilant and should avoid direct sunlight exposure. Testing the dialyzer performance. You should check the dialyzer performance before you use it to a patient. You should check the integrity of the membrane and its clearance, total cell volume and its ultrafiltration properties such as pressure test for the leaks, blood compartment volume and the water permeability. Disinfection or sterilization. Once cleaned, the dialyzer must undergo a chemical or physical process that renders all the living organisms inactive. Disinfection used in this process are peracetic acid 3.5%, formaldehyde 4% and glutaraldehyde 2%. Final inspection. Through visual inspection, if you find any discoloration or any damage in the dialyzer, then it should be discarded and not reused. Labeling. The reprocessing staff should affix the label in the dialyzer. The label indicates patient name, number of reuses, warning regarding existence of similar name, time and date of reprocessing, baseline and current total cell volume, whether the dialyzer has passed the performance testing. Storage. Once inspected and labeled, it should be stored for multiple treatment for same patient. Temperature of the storage room is important because the germicide contact time depends on the storage temperature. Advantages and disadvantages of reuse. Advantages: can avoid first use syndrome, low cost, environmental factor, can be done multiple number of times. Disadvantages: clearance will be low, infection is also caused, membrane gets damaged and cross contamination occurs. Thank you.